Setting. Okay, welcome, welcome. So these are the 8 keys, and today is key number 7. So mindset, restful sleep, right food, moving more and sitting less, building stress resilience. Last month was taking appropriate prescription medications. Today is using supplements at therapeutic doses, and next month is going to be building meaningful relationships. So, what do I mean when I say using supplements at therapeutic doses? First of all, what are supplements? So, this is basically an outline of what I'm going to talk about today. What are supplements? What is therapeutic supplementation? Obviously, there are lots of supplements that are important for brain and heart and all of health. And I definitely don't have time to talk about all of them. But today's session is going to be sort of like a part 2 of what I have talked about in the past, because many of you have heard me talk about supplements earlier. And I will make sure I share that previous one, because today's is a little, let us say, a little deeper dive into omega 3s and vitamin D. And if I had time, I would have gone into all the other supplements as well. But I realized I will need many hours to talk about all of them. But these two are extremely important. And why they are important, I'll also talk about that. So I know all of you read a lot, so you may have come across, you should not take omega-3 supplements anymore. So what is the truth? I've had patients, sending me these links. Oh, omega-3s don't really do anything. They don't help. They are not this. They're not good enough. Don't waste your money. As it is, I'm sure all of you have heard, don't waste your money on supplements. And what happened with the new vitamin D guidelines, that is the other thing I'm going to talk about. So what are supplements versus, what is included under dietary supplements? So dietary supplements include vitamins and minerals, and they also include botanicals or herbs. Now, vitamins and minerals are things that we are supposed to get from our food. Now, because of multiple reasons, we can't get them from our food alone, because number one, it's the way food is grown. Commercial preparation of food is such that the soil doesn't get enough time to regenerate. So there is this huge movement of regenerative agriculture now. So number one, if the soil is depleted, we cannot get, all those nutrients from the food that we eat. Number two is our requirement for many of these vitamins and minerals has gone up a lot. And why have they gone up? Because one is the amount of stress that we deal with. First, we're not getting enough from our food, then the amount of stress. Then there are things like prescription medications, which can cause depletion of nutrients. We may not be absorbing everything that we eat. And with different age groups, people have different requirements. Like one of the things is protein requirement, for example. Now, protein is not a vitamin or a mineral. It's one of the macronutrients. But something that a lot of people are not aware of is with age, our protein requirement actually goes up. So just saying that everyone should eat 0.8 grams per kilogram body weight per day is not, all adults cannot eat the same thing, So that is where the customization and individualization matters. So vitamins and minerals are things like vitamin B's and C's and A, D, E, K. And if we don't get enough of those, we can have deficiency diseases. Now, when I'm talking about deficiency diseases, we know about things like severe vitamin D deficiency causes rickets and osteomalacia, and scurvy with vitamin C deficiencies. Those are not the problems most of us are dealing with. But all the recommended dietary allowances, which I will talk about very soon, which were the standards for most countries all over the world, were formulated at a time when we were still dealing with deficiency diseases. Things like, rickets and osteomalacia and iodine deficiency causing mental retardation and a whole lot of things. But today's problems are not those severe deficiencies. We are dealing with more lesser degrees of deficiencies, but the consequences of that are quite serious. And unfortunately, a lot of it we don't always know. So micronutrient deficiency is common all over the world, regardless of which country you are in. And you cannot get all your nutrients from only food. You've heard me talk about that before. Now, botanicals and herbs are thought to provide benefits, but not taking them is not going to cause any deficiency disease. So botanicals and herbs are things like curcumin, ashwagandha, or rhodiola, or St. John's wort. Those, if you don't take them, you're not going to develop a deficiency disease. Versus vitamins like B vitamins, vitamin D, vitamin C, vitamin A, vitamin K. Those you can develop deficiency problems. So this is a major distinction between the two. The other problem with calling botanicals and vitamins, minerals, dietary supplements, what happens is all the, depending on which country you are in, all the regulatory authorities do not control the quality the way they do for pharmaceuticals. So a botanical may claim it has, let's say, XYZ amount of nutrients in it, but actually, unless the company subjects its processes or its products to third-party testing, where they actually test and see whether this actually contains that, it may not. And unlike pharmaceutical products, like pharmaceutical products cannot change. I think there's a very small margin of about 1 to 2%. So if a prescription medication says it contains 40 milligram of atorvastatin, it has to contain 40 milligram. So those are the pharmaceutical standards. But with dietary supplements, unless the company decides they are going to have third-party testing, or they're going to have in-house testing, which is very complex, and obviously those things cost money. They are not they are not bound by law to do all those, to go through all those testing. So some of the problems are because of that, because I'm sure all of you have heard vitamins and minerals don't do anything. Yet why is it that people take vitamins and supplements and see benefits? So obviously there's something not quite okay. It's like, of course it depends on the quality of the supplements and vitamins, and also, of course, how much and what kind are you taking? Quality and quantity, both of those matter. So when I talk about therapeutic supplementation, what do I mean? It refers to the use of nutritional supplements at doses and qualities that have demonstrated benefits in research studies. Now, herein there is another problem, because these are nutritional supplements or dietary supplements. They usually don't get funding. And without funding, how is a researcher going to do a lot of research? So very often you will not find a lot of what we call randomized controlled trials. So in the world of research, randomized controlled trials are supposed to be the highest level of evidence, which means one group of people are put on that particular intervention. Let us say one group of people are put on vitamin D. Another group of people are not put on vitamin D, but both the groups don't know who is on what. So one group is on a placebo pill, which doesn't contain vitamin D, but they don't know it doesn't contain. And over a period of time, they are followed and they are tracked for whatever particular condition they are looking for. So RCTs are not going to happen a lot for supplementation, because it takes a lot of money to do randomized controlled trials. So though we would love to see RCTs for all supplements and minerals and herbals and botanicals, that may not always happen. However, there may be smaller studies, and definitely safety is one of the things we are concerned about. So the recommended dietary allowance, as I said earlier, they were formulated at a time when we were still dealing with deficiency diseases. So they were not meant for today's life, where we are stressed, we are on multiple medications which cause nutrient depletions. We use up a lot more nutrients because we're using our brain a whole lot more. We live in the brain economy, and the brain is a big energy hog. Our brains are just 2% of our body weight, but they use 20% of the energy requirement of the body. And for the brain to function adequately, not just the brain, every organ to function adequately, we need a whole bunch of nutrients. So it's not like a single nutrient is going to take care of everything. Just take omega-3 and all your problems are gone. No, it doesn't quite work like that. So nutrients, vitamins and minerals work like a network. So they impact multiple different areas of our metabolism. And that is why it's important to understand that just taking one supplement of, I'm just going to take vitamin C or zinc for immune system, that is not going to be enough. So here is one, this study where they looked at using vitamin C for lowering blood pressure. So the dose for lowering blood pressure by, I think it was about 2 to 4 millimeters of mercury, was 500 milligrams. So you can see how much more than, and these two are the RDA. RDA for men is 90 and for women is 75 milligram. So this is the therapeutic dosage. Now, supposing someone reads, vitamin D is good for blood pressure, and they just take, let us say, 100 milligram, and 2 weeks later, 1 month later, they find that it has made no difference to their blood pressure. One reason is because they've probably taken a low dose. And 500 milligram of vitamin C is not a toxic level. For these water-soluble vitamins, toxicity doesn't happen so easily. Whereas for fat-soluble vitamins like vitamin A, vitamin D, vitamin K, I don't think toxicity studies have shown anything much. Both of those, someone can develop toxicities because they are fat-soluble vitamins, so they are stored in the fat. So vitamin D and vitamin A both have upper limits, but the good thing is there's a huge cushion between meeting your requirements and the toxicity limit. However, that does not mean that, just take bunches and bunches of vitamins and minerals without really, checking what they're actually doing for you and what is the potential for harm. So this is what I mean by therapeutic versus RDA. And here is another slide, which I have shared in the past. So this was this is a paper by Dr. Julia Ruckledge, and they used broad spectrum micronutrients. This was not just only vitamin B or only omega-3s. They used a broad range of broad spectrum micronutrients in the treatment of attention deficit hyperactivity disorder, ADHD. ADHD is extremely common these days, and a lot of younger people have ADHD. So before, and again, this is not medical advice, this is something to consider. So you can see this study where they found benefits in people with ADHD, the amount of nutrients. So this, you can see the therapeutic dose is the really long one. So vitamin A was a very high dose, but this was not at toxic levels. Whereas the RDA, one is for men and one is for women. The blue is women and the green is men. These were much lower. And you can see this for all of them. For some of them, it's like barely discernible how much the requirement is, the RDAs. So basically, what I want to highlight here is using supplements at therapeutic dosage is very different from just taking a multivitamin, which might give you a teeny tiny bit of, some mineral. Last month, I think someone had a question about magnesium. Magnesium, just the basic RDA requirement is between 300 to 400 milligram, versus if you want to lower your blood pressure, studies have shown that it's almost 1,000 milligram of magnesium. Now, 1,000 milligram of magnesium, some people may develop diarrhea. Like I developed diarrhea at about 600 milligrams, so I had to back off to 500. So my point is, when people say vitamins and supplements don't work, number one is, are they taking an adequate dosage? When we are looking at prescription medications and someone says, oh, my blood pressure did not come down with this medication, so the doctor had to increase the dosage from 5 to 10 milligram, why will it be different for vitamins and supplements? So that is my point. Sometimes if you're not getting the results, maybe you are not taking it in adequate dosage, or you are not taking the right quality where what the label claims is not really actually present in the product that you are taking. So what is this about, omega-3 and atrial fibrillation? Before I dive into that, because I'm sure many of you have read this, that omega-3 is going to cause atrial fibrillation. What is atrial fibrillation? I'll briefly describe and how common it is. So atrial fibrillation is a heart rhythm problem where, and it's not very uncommon. It's, I think, 1 in 8 or 1 in 10 people have the risk of developing atrial fibrillation at some time in their lives. And atrial fibrillation increases a person's risk for stroke. So what happened in some recent omega-3 studies is multiple studies in the past have shown that people who have a higher level of omega-3s in their blood are actually protected from having heart disease, atrial fibrillation, coronary artery disease, that is heart attacks, or sudden cardiac death. All those things, when people had enough omega-3s in their blood, these were protected. But recently, there was a trial where they used a much higher dose of omega-3s, and they found that people had a little higher risk of atrial fibrillation. Now, atrial fibrillation is not a disease any one of us want. So what are the risks for atrial fibrillation? Sorry, let me look for that. Okay. So atrial fibrillation, you can see why this is not so uncommon, because all these numerous risks, and these risks are not different from health risks for any other condition. So again, smoking and, inflammation, chronic inflammation, alcohol. One additional thing is valvular heart disease. So if someone has a problem with any of the heart valves, they are at a higher risk for atrial fibrillation and for stroke as well. Then lung diseases, sleep apnea, kidney disease. So basically, in this long list, you can see that almost every condition is connected to higher risk for atrial fibrillation. This intensive athletic training is something I added because a lot of people are not aware that high intensity exercise, whether it is marathoning or other conditions as well, can raise risks for certain heart conditions. Because people feel, I'm so fit, I am a bicyclist, I do this, I do that, I'm not overweight, I don't have diabetes, I don't smoke, I don't drink, so I'm not at risk. That may not be true. So this actually comes as a big surprise. And there is a very good book by a cardiologist who actually specializes in heart rhythms, Dr. John Mandrola. He wrote a book called The Haywire Heart. So he himself had the problem of a heart rhythm, and he's a bicyclist. So this is something which comes as a surprise to a lot of people, that intensive athletic training can make people be at a higher risk for some conditions. So again, going back to omega-3, so there is again a J-shaped curve. And if you receive emails from me, some of you, I know you're already receiving my weekly emails. And if you don't, I'm going to share the link at the end of this session where you can subscribe to those. Why I'm talking about that, for a lot of conditions, there's a J-shaped curve. So J-shaped, this is more like a U. So what they found is very low omega-3 levels raises our risk for a lot of conditions, and very high levels increases our risk. Now, what exactly happens at the high levels of omega-3? Those of you who are interested, you can read this very complex article, something with piezoelectric effect or something, and I don't claim to understand that. But I know many of you in the audience are there. What is the mechanism behind this increase in, atrial fibrillation with high omega-3 levels? So this is sort of the Goldilocks point, whereas too high or too low, too low or too high are both not good. But so this is all the risks. Now, what is the problem with omega-3? So this is a study where they looked at actual blood levels of omega-3. Because as you know, I have talked about this in the past. In the nutrition world, there are studies which we call nutritional epidemiology studies, where people are followed for a long time, but they are asked maybe once in 4 years, 5 years, or once a year to list all the food that they eat. And that is done maybe once in a year. And if you think about, what did you eat yesterday? Do you remember everything very accurately? So nutritional epidemiology has challenges because people are asked to recall what food they eat on a regular basis. And sometimes that information may not be accurate. And I'm not saying people deliberately want to lie. It's just that our human brain is such that we may not remember that. So this study, which looked at, so omega-3 fatty acids are made of DHA and EPA, so docosahexaenoic acid and eicosapentaenoic acid. When they actually looked in the bloodstream, so this was not a nutritional epidemiology study. They looked at levels in the blood. What did they find? Now you can see all the reds are the ones which is less than 4%. So in most people, if they don't supplement regularly and don't eat fish regularly, and I've talked about how by eating fish, you're not going to get, even if you eat fish every day, you're not going to get enough omega-3s. So if you're not doing any of that and you are in any of these countries, now I'm not sure which African country this is and why this is in the green, whereas all these we can explain. They live near the sea. This is Japan, so they eat a lot of seafood very likely, and that is the reason they have adequate omega-3s. Whereas if you are in Canada, the US, or well, the UK is a little bit better, you are not getting, or India, you're not getting enough omega-3s. So most average people in there, if they look at blood, the blood test report comes as a percentage. So omega-3% of a percentage of 3%, this is lower than 4%. That is very low. Whereas an optimal level is considered to be between 8 and 10. So 8% is good, but if someone has the ApoE4 gene, which raises their risk for Alzheimer's disease, they need about 10% of omega-3 in their blood. And that is the reason I always encourage people to get their omega-3 levels tested rather than assume. Just because now I know for sure I'm living here, but my omega-3 level is 8.5 because I supplement. So some of us, it's the country doesn't really reflect our levels. But if you are not taking omega-3s, you are not measuring your levels, and you live in any of these countries, the chances are very high that you are deficient. And the interesting thing is there is no RDA for omega-3s, and I don't know why. So this is, again, like I said, there are numerous studies which have shown that if they check the omega-3 levels, so omega-3 levels, these are, again, this looks like a very complex diagram, but basically what it means is those people who have higher omega-3 levels, so when they divided by quintile, so the highest quintile was more than 8%, they had lower risk for all the problems. And atrial fibrillation, like I said, it increases our risk for stroke. So even in those studies where they used higher doses of omega-3, unfortunately, they did not measure the omega-3 blood levels. So even in those patients, though atrial fibrillation was higher, they did not have more stroke. So again, the next paper is a similar one, and this is easier to understand. You can see the risk for atrial fibrillation goes down with higher the level of omega-3s in the blood. And this is a journal in the American College of Cardiology. I think even the last one was this was in the journal Stroke. So these are good, these are well-respected journals. So given this, information about high dose omega-3s being related to higher risk for atrial fibrillation, what does it mean for you? How I look at it, and this is again my opinion. So if you already have atrial fibrillation, you are under treatment, your doctor has put you on these medications, I would not recommend omega-3s for you without testing, and definitely not a very high dose. Lower doses have not been found to be a problem. So all the problems of atrial fibrillation risk going up have been with higher doses of omega-3, so more than 2 grams of omega-3. And there is a prescription product which is 4 grams of icosapent ester, which is used to lower triglycerides. That is a prescription product. It's called Lovaza, I think, in the US and in Canada. It may be different names in other countries. But that is you get it on a doctor's prescription. It's not something you can buy off the shelf in the health food store. That is 4 grams. So that is a very high dose. And it can help lower triglycerides, and high triglycerides are a risk factor for heart disease and stroke and all of that. So if you have atrial fibrillation already, then definitely you need to measure omega-3 levels. I recommend omega-3 testing in everyone. And the company that we use is called Omega Quant, and Omega Quant has a discount, so 15% discount. This is not an affiliate link. You will not get a 15% discount on my affiliate link. So you can go to their website, omegaquant.com, and they have I think until the 23rd of July, they have some Christmas in July offer, which is 15% off their regular prices. It is absolutely worthwhile getting the omega-3 test done. And that reminds me, I have a kit lying at home. I need to get mine done too. I haven't done mine in about 3 years, I think. But I was so happy when I reached an 8.5 level. So omega-3, everyone needs it because we cannot make omega-3 is an essential fatty acid, and we cannot make in our bodies. So essential meaning our bodies don't have the ability to make them. And number two, omega-3s have been found to be beneficial for, brain function, for protection of the heart, anti-inflammatory for people with autoimmune conditions, arthritis, mood disorders, so depression, anxiety, omega, and again, the therapeutic dosage versus the sort of, again, omega-3s don't have an RDA. So just bare minimum 1 gram of omega-3 may not give you the results, but you obviously have to balance so looking at an omega-3 percentage of, 10, 12% or 16%, we don't have the data. That may not, just because something is good, more may not be always better. And you've seen that. So that is about omega-3. Now, if you have any questions about omega-3 or what I've covered so far, please feel free to raise your hand, or we do have a Q&A box that is way easier. Everyone can read that then. Today, I'm feeling extremely thirsty. It's really hot. Okay, so I don't see any questions. I'm going to go back to my slides and talk about vitamin D next. So all of you know this, that low vitamin, okay, I can see one raised hand. Tanya, did I see your hand raised? No, I can't find you to unmute you. Why can't I'm sorry, I think I have to stop sharing my screen. I'm sorry about that. I'm trying to unmute you, Tanya, now I can't see you. Why can't I see the raised hand? Are you? There you are, allowed to talk. So I'm going to pause the recording for now, Tanya, before you speak. Okay. So vitamin D deficiency, now you can see whole long list of diseases which have been associated with vitamin D deficiency. So here, what happens is, what is association? What are these association studies? This means they looked at a whole lot of people. Usually these studies they include a large number of people. And what they do is let us say they measure vitamin D levels at one point, and they follow them for a certain number of years, and they see whether these particular people have a higher risk for any of the diseases, whether they have developed diabetes, whether they have cognitive decline, they've developed Alzheimer's. So those studies, and these observational studies are not studies where they give them vitamin D or anything. So when they looked at these studies, they found that vitamin D deficiency, having low levels of vitamin D, has been associated with all these conditions. Now, if we think logically, we would think that, okay, if vitamin D deficiency is causing all these problems, all I have to do is just, take a supplement or go for a little bit of sun exposure. And once I get my levels higher, I should be protected from all these conditions. That sounds very logical, but in medicine, we say that we cannot claim that and make that leap that just because deficiency diseases are associated with vitamin D deficiency, we cannot assume that just by giving vitamin D, those problems will go away unless a study has actually looked into that. And there lies this problem. So basically, if you don't have any of these conditions and you are taking vitamin D and your levels are maintained adequately, you should be fine. That is the assumption we have. Versus, can vitamin D be used as treatment? That is a different story. And we cannot make those claims that this can treat cognitive decline, this can treat schizophrenia, unless we have studies showing that. And that is where a lot of the problem lies. So what happened? This is the new vitamin D guidelines for healthy people. So I was talking to my friend and associate, Dr. Iyer, this morning. I said, you and I don't see healthy people. Why would healthy people come to me for any problems? So this is what the new guidelines came out. And a lot of, I'm sure many of you have read that the new guidelines suggest you should not measure vitamin D, you should not supplement with vitamin D. Well, as always, the devil is in the details. So they looked at prevention of disease. So prevention of disease means it is assumed that these are healthy people. The question is, how many people are actually healthy? So what do these guidelines recommend? And if those of you who are interested in doing a deep dive, this is, as you can see, it's freely available on the internet. So you can go through the long guide paper. And I did go through it. So what they said is people between the ages of 1 to 18 and older than 75 should definitely take vitamin D supplements. Pregnant women, absolutely. In pregnancy, and I'm a former OBGY, vitamin D can prevent a lot of things like premature labor and pregnancy hypertension. Those are very serious problems. All those things can be prevented with adequate vitamin D levels. And people with pre-diabetes. I was telling Dr. Iyer, this covers all my patients actually, because most of my patients are from India and pre-diabetes is very common. So if you are under these categories, the guidelines suggest, yes, you should take vitamin D supplements. But where they are struggling with is saying that this is the level you need to aim for. And the reason they can't claim that, they're like, I've actually felt like such a huge responsibility on these people who are creating these guidelines, because everyone is going to criticize them and say, why are you saying that? We have been using vitamin D in our patients and they are doing better. So the problem is in the studies. So one of the big vitamin D trials that you'll find many people quoting is the VITAL study. So the VITAL study, what they did, and I don't know why, they gave vitamin D to people who already had adequate vitamin D. They were people who were at levels of about 20 nanogram per deciliter, which is not deficiency. And when they gave them vitamin D supplements, and they gave the same dosage of supplements to everyone. Now, you and I know that everyone will not do the same with the same dosage. Like, I need a higher dosage because I have a vitamin D receptor variation. And you don't have to necessarily do a genetic test to know your variation. You can measure your blood levels. So one is they gave to people who did not have vitamin D deficiency. Second is, many of these studies, vitamin D studies, did not measure vitamin D levels. I mean, I'm sure all of you are thinking like me, like, why? Yes, I understand it costs money. Then don't do the trial unless you have the money. And the same dose of supplements were given to all, like I said. So the guideline panel expressed uncertainty. So they said this very clearly. We are not claiming that vitamin D does not help, but we cannot give you recommendations because we don't have the studies to support it. And when these endocrine society or any of these bigger, societies come up with guidelines, the guidelines have to are applicable for the general public. So the thing is, they also consider the cost. Now, testing for vitamin D, I guess it depends on where in the world you are. Some countries in Canada, many of the provinces, it's covered by healthcare. Some countries you have to pay out of pocket to get a vitamin D testing done. So if they say that everyone needs to get vitamin D testing, they also have to be aware of the cost increase to the healthcare, as it is healthcare struggling everywhere with higher expenses. So for guidelines, it is different. And number one, guidelines are for healthy people who don't have the disease. And definitely those people don't come to me. Maybe many of you in the audience are healthy, but most people are not. Like considering that pre-diabetes is in the US, it's about 80 to 90% of the population. I'm sure Canada would be similar, and Canada and the UK as well. India, I would say it is much higher, though we don't have the data. So all those people have to take vitamin D to maintain adequate levels. So therefore, this is my opinion, the vitamin D guidelines apply to a very small percentage of people, actually. So that was the last slide, and I'm going to stop sharing. Oh, it is already. Sorry about that. I don't know what's going on. Where am I? No, stop sharing. I don't need to share. Why does it tell me end webinar? Maybe I'll have to share again and then go stop it. Stop share. Okay. So, I did well for time. We have enough time for questions. What I will do now is I will share a link where if you are not receiving emails from me every week, then feel free to sign up for my emails, and you will receive emails regularly, and I make it a point to provide helpful information, and feel free to let me know if you don't find the information helpful. And does anyone have any questions? I'm going to stop the recording as well. And the name of the company is Omega Quant. Let me see if I can add a link to the company. I know they have services in the US and Canada. UK, I am not so sure.